It has been proved that vaccinations have been effective in ensuring that children do not contract particular illnesses. The vaccination that has shown a lot of change is the vaccination for poliomyelitis virus. In 1988, there were 350,000 cases of polio with 125 endemic countries. As a result of the vaccination, 16 million people were prevented from being paralyzed and another 1.5 million childhood deaths have been prevented. The problem is that even though there are clear indications of vaccines being successful and beneficial to influence human sustainability, there are still those who are skeptical about vaccinations. Polio is a severe disease which may result in lower neuron damage by damaging the spinal cord, weakening the muscles, and this resulting in paralysis. This virus can be contracted through either drinking fluids or eating food that have been contaminated by feces of a person who is infected with polio. Once ingested, the virus continues to multiply in the bloodstream, which will invade the nerve cell types, which results in the nerve cells being damaged or destroyed. When polio affects the spinal cord, it results in affecting multiple muscles in one's body. Muscles in the leg, shoulder, arms, and hands can be affected as a result. As a process of the paralysis, it may lead to respiratory arrest and death. If they survive this, the muscles will recover, and to assist this, the iron lung was invented, which helped the breathing process. It is evident that the polio vaccinations, such as the inactivated polio vaccinations, have had a great impact. The inactivated polio vaccination protects people against type 1, type 2, and type 3 polio. In America, once the vaccination was invented, it showed a 72% rate of effectiveness against the paralytic polio. Due to success of the vaccination, it was mass-produced and distributed worldwide. Even though there has been successes, there are still those who have speculations about the vaccinations. Many of these speculations arise due to religion, in particular to the Islam religion. People led to believe that the vaccination was a form of birth control, an aspect that is highly frowned upon in Islam. Social media is also to blame for rumors that are spread easily. A Facebook group called Mothers Say No to Weaken Vaccines was created in 2013, which influenced parents. Due to rumors and conjectures, Pakistan, Afghanistan, and Nigeria are still affected by vaccine-derived poliovirus and the wild poliovirus. There are 11 wild polioviruses in the world and 49 vaccine-derived polioviruses that have been reported. The World Health Organization, Rotary International, the US Centers for Disease Control and Prevention, UNICEF, and other high-profile persons are involved in the Global Polio Eradication Initiative. The objectives of this project being completing the eradication of poliovirus where still evident, transitioning from OPV to IPV whilst also ensuring the routine immunization system is strengthened, making sure that the poliovirus laboratories and facilities are under control, and lastly, using the lessons of polio for other such diseases. Since the initiative has been created, polio has decreased by 99%, and 80% of the world's regions are certified as being polio-free. To assist the aim of polio eradication of the world, we need to help, and to help, we need to make sure that our future generations are being vaccinated to stop the spread of this severe disease. To finish off this presentation, I would like to end it with a quote. As a reply to when questioned on the safety of polio vaccine he developed, Jonas Salk said, "It is safe, and you can't get safer than safe." That concludes my presentation, and thank you for listening.